How do you do that?
Oops.
Does anyone want to be taken off video? Because I can take them off.
I just did.
Okay.
Oops.
Okay, so if anyone doesn't know, my name is Erin Kilkenny. I'm a physical therapist here at Willow Grove Physical Therapy. I've been working here for the past 9 years, and I've been a certified vestibular therapist for the past 8 years. So I've been here a long time, and now recently we have 3 offices. So Willow Grove office has been around for about 17 years. Hapro's been around about six now, and we just recently opened up an office in Glenside, right on Easton Road next to Copper Beach Elementary School, if anyone's familiar with that. So Kevin Lynn is over there right now, and so is Micah Mole, if anyone knows those therapists. So we have 3 different locations now. And this presentation is a combination of information from myself and some of my colleagues, including Courtney and Margaret. So I'm just going to be talking to you guys today about how to effectively manage dizziness and imbalance as you age.
What happens if it has nothing to do with age?
Well, all of these things can work as you get older.
Okay.
Why can't I get to the next screen? Hold on, this is frozen.
Will we get a copy of your PowerPoint?
Kyle, have we been sending that out or not typically?
I think it's up to you. We can, if you want, maybe just send us, you can send me an email, kylekamerly@gmail.com. It's in the confirmation email that you got for this. So you can either email me or email Erin, and we could maybe just like send it to you individually if you want copies. But we don't like send a mass like email.
Okay.
Okay, so some of the things I'm going to be going through today are to go over the most common form of vertigo, which is BPP, benign paroxysmal positional vertigo. Talk a little bit about the balance system, go over some fall statistics and fall risk factors, and just discuss some general exercise guidelines from the CDC.
It's okay with me.
Right. So the first thing I just want to go over is what is the vestibular system. So the vestibular system is an organ within the inner ear, and basically it functions to help communicate information to the brain to detect head and body position. So it helps us to maintain an upright position against gravity, and it also helps to maintain the ability for you to move your head quickly, like shake your head side to side, and keep things in focus. So dizziness can be a little bit difficult to understand just because people tend to use dizziness when they mean a lot of different things. So some people use the word dizziness when they actually mean that they're having vertigo, where things are spinning or they feel like they're spinning. And sometimes people will use dizziness when they feel like they're off balance or they feel like they're going to pass out. And sometimes people will just mean it when they feel this general sense of, oh, I don't quite feel myself, or I'm feeling a little bit unsteady. So we try in therapy to really disassociate what people mean when they mean dizziness, whether they mean like they feel like they're going to fall, whether they feel like things are spinning, or whether they feel like they are going to pass out. So what is vertigo? Vertigo is a sensation of movement of yourself or your environment that people will most oftenly describe as room spinning. So people will typically describe to us that when they look at something, whether it be, you know, the clock light next to their bed, or they look at something in their room, that when they roll over in bed or look up, that they're actually seeing their environment move around them. So the one thing to note is that vertigo is a symptom. It's not a diagnosis. A lot of times people will go to their doctor and they'll get a diagnosis of vertigo, but there's many different causes of vertigo, and that's what we try and differentiate in physical therapy. And a lot of times vertigo can be a result of an issue within the vestibular system, within your inner ear. So some different causes of vertigo, and there's quite a few. Today, we're only going to talk about the most common one, which is benign paroxysmal positional vertigo. There is some other causes listed here, and these are all usually diagnosed through a specialist, or even just sometimes in therapy, we're able to diagnose these. And more of the central issues, which mean issues within the brain, most likely would be addressed by a neurologist. But any of the peripheral issues of vertigo, we can, and even some of the central ones, we address in physical therapy. We just don't diagnose those. So what does BPPV exactly stand for? So it stands for benign, meaning it's non-life threatening. Paroxysmal, that it comes in sudden, brief spells. So this is usually brief in duration, meaning less than 30 to 60 seconds. It's typically triggered by head position changes. Usually looking all the way down or looking all the way up, getting in and out of bed, or rolling in bed will be the most common positions. And it's this true sense of vertigo where you have the sensation that things are moving. So like I just mentioned, it usually occurs getting in and out of bed, bending over, and looking up. And it lasts less than 60 seconds. And there's nystagmus present. So this is how we diagnose BPPV, is by actually looking within the eyes. So if someone has BPPV, when they go to lie back in different positions that we examine in the office, we will see this rotational movement of the eyes, and that's how we are able to indicate whether someone has BPPV. It sometimes can be associated with an unsteadiness and loss of balance. In some instances, people will have nausea and vomiting, and it really can vary in severity for people. So what happens with BPPV is, if you see I have my little cursor here, we all have these crystals that lie deep within this portion of your inner ear. And the whole inner ear, your vestibular system, is oriented deep within your skull. No doctor can look in here and see this part of your inner ear. It's nothing anyone can touch. So this is just a picture basically within your skull. So right within this organ right here are these calcium carbonate crystals. So we all have them, and they're supposed to stay right within this portion of your inner ear. Now, when someone has BPPV, the crystals get displaced within these canals out here. And when that happens and people move their head in certain positions, it causes the crystals to brush up against hair cells that line these canals. It sends this false signal to your brain, and that's why people will get this rotational movement of the eyes that we call nystagmus. And that's when they feel really dizzy. So what we do in therapy is try and clear the crystals from the canal where they're not supposed to be by rolling over in certain positions. And I have some videos of that we'll go through. So the prevalence and cause of BPPV, it typically affects 107 per 100,000 people per year. And there's a 2.4% chance that someone may get this within their lifetime. Now, there's really no known cause of why it happens, but it is associated with some increase in age, trauma, migraines, inner ear infections, if someone has diabetes, osteoporosis, or reduced blood flow overall. So how to diagnose BPPV? So in the office, you have a consultation with a vestibular therapist. We take the patient's history and go through some different balance tests and different eye examinations. But then we do the true test to diagnose BPPV is a positional examination. So if you see here in this picture, this is Anne. She's one of the other therapists in the Happer office. And this is Margaret here. So she's lying back, Margaret, with her head extended off of the table. And she's looking at the TV here. And she's looking at her eyes. So if Margaret had these crystals displaced from her inner ear, Anne would be seeing this rotational movement of the eye up on the screen here. And Margaret would also be getting very dizzy at the same time. So that's how we are able to tell if someone has these crystals out of place. It's by looking at their eyes. We either look at them through the goggles or just look at them in room light, lying them back into different positions. And we're looking for them to become really dizzy and them to also have this nystagmus within the eyes. And we also have to determine which side is involved. So this is something that can happen on the right side, on the left side, and there's also different canals that can become involved. So that's where really looking at the eye movement and the way the eyes are moving is extremely important. Sorry, Kyle, my computer keeps freezing.
All good, no worries.
So I'm gonna pull up a video of kind of going through the treatment for BPPV while, and we'll go through that next while I'm trying to get this PowerPoint to keep loading. Okay, are you able to see this this YouTube video?
Yeah.
Jackie, can you pull up how to get the audio on there?
Yeah. So you have to do it, Aaron, hit share screen and advanced settings, and then it should be there.
Got it, okay. Okay.
Normally, only with head movement does fluid within the inner ear also move, informing the brain that a head turn occurred. However, should a crystal called an otolith gets displaced into the posterior canal of the inner ear, BPPV dizziness occurs. Fluid movement occurs due to the crystal rather than head turns, causing the brain to think movement has occurred even though none has happened. The Epley maneuver is performed to treat this posterior canal BPPV by trying to get the loose crystal out of the canal. This maneuver is started by turning the head 45 degrees and the body laid back such that the head is extended about 20 to 30 degrees. If BPPV is present, eye twitching called nystagmus will occur. After 30 to 60 seconds, the head is turned 90 degrees to the opposite side and held for another 30 to 60 seconds. The head is then further rotated another 90 degrees, accomplished by having the patient turn onto their side, which is then held for another 30 to 60 seconds. At this point, the head should be turned 45 degrees from the horizontal. When performing this maneuver, another individual can help with these position changes. The maneuver is then completed by having the patient sit up. So what's going on with these position changes? Essentially, the head is moved in such a way to manipulate the crystal to fall towards the canal opening. With each position change, it takes about 30 to 60 seconds for the crystal to settle into the most dependent position in the canal. If turns are made before the crystal has a chance to settle, the crystal may fall back the wrong way and the maneuver will fail. It's also important that the head positions are angled correctly, or else the crystal will not settle to the correct position in the canal and the maneuver will fail. Also, if the position changes are done too slowly, the crystal may not settle quickly enough from lack of momentum and the maneuver will also fail. Once the crystal falls out of the canal, the dizziness should resolve if due to posterior canal BPPV.
Okay, so you guys were able to see that okay?
Yes.
Okay. All right, so let me try and get the PowerPoint back up here.
Which one of these foods contains a protein that can make your arthritis pain worse? You'll learn the answer in this quick 3-minute video. Here's what happened when people
I can't see it.
Okay, so let me go back here. Okay, so that was going through the treatment of the what we call the canalith repositioning maneuver to try and clear the crystals from the canal from where they're not supposed to be. So usually those maneuvers that we just went through on the video, they're performed 2 or 3 times within a session. We always instruct patients on how to do the home maneuver because that can assist in resolving the issue faster than just coming in and doing it in the office. And the goal of the treatment is to reposition those odoconia, which are those crystals, back where they belong. There's usually a resolution rate of 90% in 1 to 3 treatments. But the thing to know is there can be a reoccurrence, and people usually have a 50% recurrence rate within 5 years. But this isn't something that typically people experience very close together. Usually there's months or even years between episodes of having this BPPV. And then we just went through the maneuver of how to do the treatment. So some things to just kind of conclude about BPPV is it can be common, especially as you age. And when you have BPPV, and it can affect your function, balance, and overall safety. It increases your risk of falling. It can be diagnosed and treated with conservative, non-invasive techniques, which are those maneuvers we do in therapy. And it can be corrected typically in 1 to 3 sessions to reduce dizziness and improve balance. And it is just one of the causes of dizziness and imbalance as we age. We know that there are some of those other causes that I briefly mentioned in the beginning. So the next thing we're going to go over is our sense of balance. So the balance system is made up of your eyes, your ears, your legs, and your brain. So your eyes assist in determining kind of where you are in space. The ears are the vestibular system that we just talked about, the deep part of your inner ear that helps determine where your head is in space. Your legs helps feel the ground underneath you, and the joint sensors within your legs help determine where your body position is when you're standing. And then the brain kind of puts all that information together and helps process that. And we know that balance is really the key to our independence. If you don't have your balance, you're going to become reliant on others and reliant on assistive devices in order to help you get around in the community. So some questions to just kind of think about to yourself is, have you fallen this year? Are you afraid of falling? And do you hold on to furniture when you're walking around in your home? If you answered yes to any of those questions, it's very possible that you should be evaluated by a physical therapist to determine if you are at a risk of falling and could benefit from physical therapy. So just to go over some fall risk statistics. So falls are very common, which is not a great thing for us. It's the leading cause of accidental death and injury in people 65 and older. And 33% of older adults fall annually, which is an extremely high number. And the thing that can be that we don't like to hear is that only about half of people talk to their doctor about it. Because a lot of times people will tend to think that falling, it can be part of the normal aging process. And as we get older, that people typically just tend to fall. And that's not the case. There's a lot of things we can do to reduce falls. And that's one of our main goals in therapy. So falls also are the leading health concern for people greater than 60 years old. 1 in 3 adults greater than 65 years old fall, and 1 in 5 falls lead to serious injury. And percentage of falls increases with each decade of life. And you can kind of see how high those percentages go up through there. Okay, so some fall risk factors. Some things that can be signs that you may have a fall that could come about in your future. If you have difficulty standing on one leg greater than 5 seconds, if you're veering when you're walking, if you're holding on to someone for a little extra support, if you've had what we call like near falls where you're kind of catching yourself, and if you're fearful of walking. And this little chart over here on the side just shows that if you have these conditions, how much more likely are you to fall? So if you've had a fall in the past year, you're 5 times more likely to fall again in the future. If you have weakness, peripheral neuropathy, which is decreased sensation in your feet, balance issues, slow gait, if you use a cane, vision problems, all of those different things can contribute to falls. And if you'll see at the end there, another one is greater than 5 medications. So medications can also have an impact on your risk of falling. We know that if people have very extensive medication lists, that they're at an increased likelihood of falling. So I just kind of mentioned that falling is not an inevitable part of aging. We know that 2/3 of falls are preventable, and there's things that we can do to help prevent those falls. So some of those things we can think about is it has to be an evaluation and management of multiple risk factors. That's the way we know it's the most effective to reduce overall falls. So some of those things to look at are the medication list. So kind of going over your medication list with your physician, looking at, is there anything specific that, I may not need this medication anymore, or just discussing and streamlining the overall medication list with your physician. Looking at postural hypotension, whether people are having any reduction in blood pressure when they're changing positions, looking at overall strength, balance, and also how the home setup is, whether there's tripping hazards within the home, or area rugs that aren't securely down that could possibly be up and cause hazards throughout the home. Sorry, it's frozen again. Hold on. Okay, so some exercise to improve balance. We want to do strengthening, standing balance exercises, walking, and aerobic exercises. So they're just some examples of some pictures we do to help work on strength: sitting and standing from a chair without holding on, standing for balance in a corner where you could be safe, walking and sidestepping at a bar. So some what we call static balance exercises are just standing balance exercises. So typically when someone comes in and we evaluate their balance, we have them do these various positions: standing with the feet together, eyes open, eyes closed, 1 foot in front of the other, eyes open, eyes closed, standing on one leg, eyes open, eyes closed, and then standing on a foam cushion, eyes open, eyes closed. So there's normative data for all these different positions based on people's age. So we evaluate in the clinic how your balance scores match up to other people within your age category. And if you're having deficits with some of these different positions, we can work on these exercises. And we're always guarding our patients, standing next to them. And when they're working on them at home, they're standing in front of a counter or somewhere they can be safe to practice these things. But if you try these and you notice that you're having any issues with your balance, it may be warranted to come in and get evaluated by one of us to see how your balance scores match up to other people your age. So some more dynamic balance exercises, meaning like moving and walking, or, you know, sometimes we have people sidestep with a band around their legs to kind of provide some more resistance and overall strengthening, doing squats, weight shifts, getting up and down from the chair, walking one foot in front of the other, stepping up onto a platform, and all this stuff we are guarding our patients and evaluating how safe they are to do these on your own. So we would never have someone do this by themselves without being evaluated in the clinic first. So just to go over some general CDC exercise recommendations for older adults. This slide just really shows the importance of how much aerobic exercise and strengthening exercise all older adults should be doing. So for aerobic exercise, the guidelines is 150 minutes a week of moderate intensity exercise. And moderate intensity is really something that gets your heart beating faster. You just don't want it to be like a slow stroll outside with your dog where you're having to stop multiple times, because that's not really getting your heart rate going at the rate it needs to be to get that moderate intensity. It really can be anything. It can be biking, swimming, whatever you like to do that gets that heart rate going for those 150 minutes. Also, we know now that strength training is so important no matter what age you are, and that's really recommended to be 2 times a week. The only way to make those muscles stronger is by challenging them. So, you know, if weights are getting too easy, you increase the weight. You really want to be challenging those muscles in order to make them stronger overall. And then the balance exercises you want to be doing at least 3 days a week in order to keep your overall balance. So some conclusions about balance is that it always can improve with exercise. And it really is a combination of a variation of exercises. It's not just one thing. It's strengthening, it's walking, it's doing standing balance exercises, different dynamic balance exercises, whether you're walking and strengthening, stepping up on a curb, using the stairs. And they should all balance exercises whenever you're doing them should be within a safe environment. You never want to take a chance of falling. If you're fearful of falling, you really want to seek out help. No one should ever be fearful of falling. If you're fearful of falling, we absolutely want you to come into therapy and get help from us, because this is something we can address, and we do it every single day. An evaluation from a PT can help determine for you what are the most appropriate exercises, because not all exercises are appropriate for everyone. And that's what we do in our evaluations. We really take the time to assess and determine which specific exercise group would be the most important for you. And then we kind of touched on this already, but I like this saying here that a tendency to fall and symptoms of dizziness should never be dismissed as an unavoidable consequence of aging, but it may be an important sign of a condition that can be cured or controlled. So you just don't want to write off, you know, oh, I'm a little dizzy or I'm a little off balance as something that's just happening as you get older. You really want to mention it to your doctor, get it addressed, come in for therapy, because it's something that can absolutely be worked on. So here's just some references, and then just questions. So.
You're muted now. No, I'm not. Is Willow Grove office opened?
Yes, so good questions. Let me take everyone off of mute here. So all of our offices are now open. We are only seeing 1 patient per hour per therapist. So we're seeing less patients overall in the office due to the coronavirus.
I've been there twice.
No, I mean, you want to leave this session?
Yeah.
We
Unless
also,
you want to continue on it.
We also are following all the CDC guidelines as far as in the office, social distancing. Our waiting rooms are set up differently, so people can't be sitting as close together. So we're taking all the precautions that we need to within the offices to follow the current recommendations. Now so each office is open, and we're pretty much open to regular hours now. And if people don't feel comfortable coming into the office, most insurances are covering telehealth appointments now. So basically it's doing physical therapy through a platform such as like Zoom, like we're using now, in order to evaluate and treat patients if they don't feel comfortable coming to the office.
I have a doctor's prescription. Do I bring that in for you for physical therapy treatment?
Yes, you can just call the office. We're here tomorrow at 8. So just call and we can set you up with an appointment.
Where's Kevin?
Kevin is in Glenside.
Why?
Because it's closer to his house, Eve.
You know me.
I knew it. I knew it. Does anyone else have any questions?
Look beautiful today.
Oh, thank you.
This was great. Thank you.
That's good. Thank you.
Oh, no problem. Yeah, so if anyone has had any recent dizziness or you're feeling unsteady, please reach out. You can email myself or Kyle if you have any specific further questions. And if anyone wants to come into any of the offices, just give a call. The secretaries are here all day.
I have a question.
Sure.
I went through this therapy years ago. It was the best thing since sliced bread.
Oh, that's so nice.
Fantastic. In the Willow Grove, in the Willow Grove office, and I've been very fortunate. It's been so long, I don't remember how many years.
Oh, wow.
Suddenly, I am in my 80s and I'm in trouble again.
Oh, no.
So I pulled out my sheet of instructions, but it's been so long that there are some things I don't remember specifically. What I do remember was being the position on the table and the head turning to one side, but the printed instructions that I have show the patient turning the head to one side, and then it's the other side where they're turning head all the way down. And that's not my recall. What I remember is that everything happened to the one side, the 45-degree angle, and then chin down to chest and over the edge on the same side. Now,
so you typically go, so whatever side the issue is, like say the issue was the right side, if the crystals were out of place on the right side, you typically go down on the right side,
okay.
then you turn your head to the left, then you roll onto the left and sit up on the left.
Okay, so if I were reversing that,
Then
okay.
Yeah, so if the issue was the left, like if the crystals were out of place on the left side, then you would start on the left, turn your head to the right, roll all the way on the right, and sit up on the right side.
Right. I remember it from therapy, and it's the same symptoms. I'm assuming that it would feel the same way.
Yeah, and the way you know if it works is if you go through the treatment, the first time and you have very severe symptoms and the room is spinning as you're going through the treatment.
Yeah.
If you do it that first time, and then the second time, if you go through and nothing happens, then you know it works.
Okay.
But if you're still trying to do it and it's not working, then just give us a call, Donna, and we can try and get you back in or talk you through it through the computer like this if you didn't feel comfortable coming in.
Well, I really appreciate this session because you just clarified something for me.
Oh, no problem.
Very good. Thank you so much.
Oh, no problem. I'm glad we can help.
Can I add to Donna's situation? I'm her husband. I'm
Hi.
Donna had an incident this morning, and over time, I found that the weather has a lot to do with it. Today, there was a thunderstorm late in the afternoon when Donna was really miserable. As soon as the weather cleared up, she felt better.
Yeah, and some people do tend to tell us that the weather has an effect on their vertigo. We don't necessarily know through research whether that's the case, but it is something that people tell us sometimes. So I'm not quite sure what the issue, like what the science is behind it, but it is something we've heard before.
I used to have a barometer and measured it, but that was years ago. But today was an example that I've never seen before. It was clear. It seemed clear. That's it.
Well, yeah, it's something we've heard before.
Thank you.
No
This-
problem.
This was very helpful for me because I can go back to the drawing board. I can trust what my memory tells me, try it, and I am thankful to know where to find you.
Oh, no problem. Yeah, I'm glad we could help.
But I cannot say enough about the experience those years back, and it's got to be 20 to 25 years. Yeah.
Oh, thank you so much, Donna.
Thank you, and thanks for having us.
No problem. Anyone else have any other questions?
I keep looking at Kyle's face. Kyle keeps smiling, and I can't help it. It just makes me smile back.
I know, Kyle's always so happy.
Good. Keep it up.
All right, well, thank you so much, everyone, for taking the time to come out, and I hope everyone's staying safe and well, and you know where we are if you need us.
I'll see you tomorrow.
Thank you.
Thank you.
Thank you so much.
Bless you yourself.
Have a good night.
Thanks. You too.
Bye-bye.
Good night. Honey, what do I do to turn this off, please?